and play.
Hello, everyone. Welcome, welcome. Happy holidays. We're in the festive Merry Christmas, Happy Holiday mood.
It's a little obvious for us, isn't it?
So I have the comments showing up on the stage. So hello, Sharon. Hello, Fanny. Let's see. Margaret from
Shantea, Pavitra, Julie.
Special edition webinar. I like how she says that.
Very good.
So we started a little early so people got their little pop-ups and reminders from YouTube and LinkedIn and all the various places. And I need to go set up Instagram.
And that means we want you to share too. This gives you a few minutes to share with your friends and peers, and so that they can join us as well.
Yes.
Remember, you help us advertise because we can't afford to advertise. And word of mouth really is the best. It's, that I think that's a better way to go.
So why don't you let them know what topics we're going to be covering tonight?
Very good. We have two great topics that came from people that have been watching us for a while. The first topic is about the CRC exam. They want a game plan and the layout of the exam and practice tips. We've been doing this for many years. And so we've talked about it in the past, but now we've got a refreshed insight, I guess, a version of talking about that particular credential. If you have other credentials you want to know more about in the testing process, let us know. And then pivoting from coding to something else. We're going to talk a lot about other careers or other things that you can do besides what I like to call in the trenches coding. There's so many opportunities out there when you have a good knowledge of the code sets, and having that credential proves that you're an expert. However, you may not be aware of all the opportunities that are available to you in this career. And we have both seen, Laureen and I both through the years have seen some real unique opportunities. And so we're going to talk about some of those and things that, again, you may not even have been aware could be available to you.
Thanks, Alicia. That's when I turned my camera off for a minute because I had to go start the stream on Instagram, and we were teasing each other because she was in the little Christmas tree branch.
Now you're in the Christmas tree branch. I am there, right?
And we wanted to say thanks again to Kristen, who's been doing a lot of the slide decks. We have quite a few interns now, and we're about to onboard 5 more over the weekend. So if we can take as many as wants to come on, because we are getting lots of topic requests coming in. It's very exciting, really, really good topics. And Kirsten is really becoming a pro, as you'll see tonight when you look at the 2 mini decks that we're going to be presenting for you. So actually, what time is it? Are we?
Oh, hi, Carmen.
8 o'clock.
I know Carmen from New York when I was working with SUNY. She's been joining us for quite some time. So shout out to Carmen. Thank you.
We love our long timers. So since it's officially 8 o'clock, we'll just do a quick recap of what we're going to be covering tonight. This is the Community Q&A webinar number 1730. And Alicia and I will be presenting for you tonight. And the 2 topics we're covering is your CRC Exam Game Plan, layout and practice tips. Alicia's going to take the lead on that, and I'll chime in a little bit, and then I'll take the lead on pivoting from coding to something else. And Alicia will jump in that way as well. So while Alicia's primary, I'll be looking at the chat and maybe pulling up comments if it applies. So feel free to ask questions throughout. You don't have to wait till the end. And we were just thanking our intern, Kristen Estes for preparing the slide decks. So you'll be able to see how great her work is. And I'm going to bring up the first one and let Alicia. Alicia, you just tell me when you want me to advance the slide. And
okay, I am going to put it on my screen.
oh,
So
okay.
that no. You do that, but I want to be able to see a little bit bigger. I was just telling Laureen I tried to take my glasses off, and I thought, oh, I will be able to see. Uh, anyway, and no, I can't. So
Oh, and Katerina is asking about, will we share the slide deck? The slide decks are for our club members. So become a club member and you'll get the slide decks, you'll get the replay, you'll get access to us, and you'll get CEUs for the webinars that we get approved for CEUs. So what we do is we provide this streaming for free. Anyone can watch and attend on many, many channels: YouTube, LinkedIn, Facebook, Instagram, and of course StreamYard, which is what we're using to do this multiple streams. But all of the goodies are for our club members. So we have, we're going to talk about that after this presentation. We'll go into the different ways that you can become a club member. Mm-hmm. Thanks for asking. All right, Alicia, take it away.
All right. So again, we will be looking at your CRC exam game plan, the layout, and practice tips. As we look at the AAPC CRC exam, there are a few things that you should be aware of, and that this is all applies to the layout, what's in the exam. I think one of the things about taking an exam, especially a credentialing exam, there's a lot of pressure and a lot of weight on you. However, if you fear that process, and so many people do, it's because it's the unknown. So the more exams you take for people that get multiple credentials, that fear is alleviated because you've already been through the process. However, for some of you, if you're thinking about taking a first-time credential, we really want to break down what's in the exam. And just so you know, this format is similar to multiple credentials through this organization. So the first thing you need to be aware of is that you're going to have 100 questions. They are multiple choice. Now, for some time, we have spent a lot of detail in explaining how to do multiple choice questions. And there's kind of an art to it. Their exam is 4 hours. It is also open book. So that should really alleviate a lot of your concern and fear as well. Now, when I say that it's open book, that means you will have your ICD-10 manual with you when you take the exam. And if you've gone through our course, then you've already annotated your ICD manual. So the pertinent notes that are going to give you an edge on the exam are already there ready for you to go. The exam is going to cover risk adjustment models. It's going to cover ICD-10 coding and the guidelines. It's also going to cover compliance and regulatory requirements. Now, we're going to talk about those in more depth in just a moment. The passing score is 70%. The reason that when you take practice exams, we want you to get 85% or better on our exams is so that you will feel confident that you're going to do fine at 70% to pass. Now, that being said, I want to mention that our exams, we've been told multiple times, is harder than the real exam. But I think that's because we try to cover a lot of specifics in one exam question. Not all of our exams are 100 questions, our practice exams. All right, so moving along.
I wanted to say one thing to remind people that 70%, what you have to think about it, your job isn't to get an A. Your job is to pass. So that means out of 100 questions, you can miss 30 and still pass. And, you got to really reflect on that. So, because that will help change your psychology with any of the certification exams. When you know how many you can miss, you don't have to tell people your score. You just need to say
Right.
you passed. That's all that matters. So keep that in mind when you're going through the questions.
And Lana had asked if what's changing in 26. We'll get more of that information for you at the end. Now, moving on, the breakdown is that you've got 100 questions. You're going to have 15 questions in compliance. Keep in mind, guys, that compliance is going to be covered in all credentialing exams, and they are going to be somewhat specific to the CRC, in that you're going to be talking about RADV audits and the coding errors that will trigger for RADVs, but that's not all. Still regular compliance questions that have to do with coding and ICD, but the specifics will be, you need to know the different types of audits, the prospective, the retrospective, what a RADV audit is, and the most common errors. Now, don't worry, I'm not going to spend a lot of time explaining what some of these terms mean, because we do that in the course, and we also have done videos on this so that you can go jump out into our YouTube channel if you want to see. Or of course, you can go in and look at our free information that we have in our platforms. But a RADV audit is absolutely a term you'll want to have down pat. For coding, this should actually be the easy part for you, one of the easy parts, because you're just dealing with one code set. However, they're going to make sure that you understand the guidelines surrounding specific diagnoses. And a lot of these will have coding clinic guidance. Now, many of you are not going to have access to coding clinic because, quite honestly, it's very expensive. You can pay for it to be added through your EMR that you get, but we talk about the coding clinic guidelines pretty frequently in the course. And a little tip, if you're not sure if there's a coding clinic regarding a specific scenario, you can Google and it will come up. So somebody's probably already written a paper on it. So coding clinic guidance, what are the most common errors in risk adjustment regarding the diagnoses, and the specific main diagnoses that you see commonly in risk adjustment are listed here. And I can tell you that just picking one off the top of my head, COPD, one of those guidelines is that when a person has gone from COPD and developed into emphysema, you no longer code the COPD code, you code for emphysema. That's a coding clinic. That's also in the guidelines. So it's things like that that they will test you on. They'll have you'll be abstracting for a patient that has COPD, and the imaging revealed emphysemas changes in the imaging, and then you have to know that it's been escalated to emphysema, and that's the code, the J43 code instead of the J44 code. Now, documentation improvement, this is huge, and this is something that, a little sidebar here, we're working on a CDI course as I speak, and this just really shows how important and an integral part of what we do now in mainstream coding, that is CDI driven. So there'll be 12 questions on communicating discrepancies and identifying discrepancies. A lot of this will have to do with things like querying, how to do a proper query, and what's missing in a diagnosis description that's needed to be able to get specificity, things like that. Pathophysiology, terminology, and anatomy. You're only going to have 5 questions in here. However, I want to encourage you to make sure you have a lot of confidence here in this area, because there is only 5, and you should have these down pat. And they're not going to be questions like, let's see, what's the difference between, COPD and emphysema? Well, emphysema is structural changes in the alveoli. It's going to give you a scenario and then put that question in there. So it's not going to be just pure give me's like A, B, C. However, there's only 5. So you want to make sure that you have confidence with this. And if you don't, I encourage you to pick up, say, our pathophysiology or medical terminology course, even if it's a brush up, because that's 5 questions you should get right. And it's going to be things like acronyms, the terminology, the structure of the vascular or the arterial system, for instance, functions, disease process. And just going back to COPD turning into emphysema, that's a disease process. Diabetes that starts having causal relationships with wounds, ulcers, kidney disease, so on and so forth. What type of kidney disease would be end-stage renal kidney disease, things like that. So the risk adjustment model, this is one of the areas that makes risk adjustment unique from other credentials that in coding that you'll be doing. There'll be 15 questions, and they will be on the Affordable Care Act. They'll also be on the hierarchical category codes, or the HCCs. So we are now in version, at the time of this, we're in version like 28. Well, some diagnoses in the previous version that carried an HCC might not now, and some they've brought back. So you have to be able to understand those. You have to know the difference between an RX HCC and a regular HCC. And then also understanding the risk adjustment score for a patient. We call that the RAF score. And you may be called to figure a RAF score. Now, don't think that there'll be math involved. All the information that you need is given to you. And again, this is multiple choice. Purpose and use of adjustment models. Why do we do what we do with risk adjustment? What's the driving force behind it? Data mining, how that's done, predictive modeling, and trumping in hierarchy. So the predictive modeling, when we're looking at that, we're saying that knowing how sick a patient was the previous year allows us to budget and predict their RAF score in the future. And then hierarchy, saying, emphysema trumps COPD, stuff like that. Quality of care. There's only 3 questions here, but they are key to what we do in risk adjustment. One is HEDIS. If you're familiar with HEDIS, you usually hear that a lot with the inpatient stuff, but it also applies with risk adjustment. Star ratings is it's pretty multifaceted. However, one of the things that pops out is, the people who are on Medicare, they get to rate the quality of care they're getting from their providers, and that could even be as simple as, did you like their waiting room? Cases. There's 10 cases at the end. They are multiple choice, and this is where you're going to actively show that you know how to abstract diagnoses at the proper specificity, and how to see what documentation you're allowed to capture from and what not, and what would prevent you from capturing a diagnosis. And we teach all of that in an exam. So just because the doctor has a statement that the patient has diabetes doesn't mean that you can capture that for risk adjustment. It has to have meat behind it. So we talk about that pretty frequently. Now, the exam breakdown, again, 15 questions in compliance. They're going to look at how well you know prospective audits, RADV audits, retrospective audits, and your ability to identify common coding errors. A lot of times those coding errors come in specificity. Think briefly. If a patient has hypertension, that's I10, but if they have hypertension and CKD, that's I12, and if they have those two in addition to CHF, that's I13. So your ability to know that is going to come through on this. And when we talk about prospective audits and retrospective audits, meaning are you capturing data real time in the year that you're in or the previous year? And you can be called in different positions to be doing both. One day you may be doing one, and another day you may be doing both. So that is a lot of extra work on your part to keep your head in the right perspective and looking at dates and so on and so forth. Access and knowledge to the ability to do these type of audits, what they mean, why you would do them, and the purpose of RADV audits, all are explained in the course, and that you will need to be well versed in, because this is a big part of it. 15 questions and identifying those errors. Oh, I didn't move my screen. Sorry. I was waiting for Laureen to move the screen. It's like she's moving it over here, but I've got it big over here so I can see it. Now, the bulk of what you're going to be tested on is that ICD knowledge. We do a great job with our course, very heavy in ICD because, of course, I really, really like that. But I also understand the purpose behind it. You have to know the ICD guidelines inside and out. And we always encourage our students to read the guidelines when you start the course. You're not going to understand what they mean. Read the guidelines as you're going along in the course, as each area that you're in. And then at the end, go through and read them again, because that's truly what you're being tested on when you're dealing with the diagnoses of the CRC exam. In addition, you're going to demonstrate that you have the ability to properly code specific diagnoses, and we've got those listed here on the next slide. And isn't it nice they were put in alphabetical order? Some of the things that risk adjust at a very high level are things that they're going to absolutely test you on. And one of those is amputations. If you have a person that's coming in for an annual wellness visit, they're not being seen because of their amputation. However, if an amputation's mentioned, you get to abstract for that and pull that HCC out. And that's what's different about risk adjustment versus your other types of coding. We're looking for the diagnoses that the patient carries over an entire year. So things that are often missed and why you're being tested on them is amputations, artificial openings, people that have had strokes, mental disorders. I'm not going to read all of these different manifestations of disease. Malnutrition is also overlooked and sometimes missed. And let's see, that you can see the rest of them. I'm not going to read all of those. DVTs. Another thing is, notice how many acronyms we have: CHF, CKD, COPD, CVA, DVT. You have to know what those stand for. And that this is only just a tip of the iceberg, because in the medical field, we abbreviate everything we can possibly abbreviate. And some abbreviations are the same as others.
Alicia, would it be correct to say that you need to know how to do ICD-10 coding in general, but
Correct.
on the exam, they're focusing on these diagnoses because these are the ones that carry the weight for risk adjustment for the HCC categories, right?
That would be a true statement. In addition, these are the ones that are commonly found with mistakes.
Okay.
So therefore, they want to make sure that if you're going to take a credential and be a specialist in this arena, then you need to be very, they want to test your ability to find these things that are overlooked and missed opportunities. And these are the biggies.
All
Yeah,
right.
these are
Great.
the biggies. And even like neoplasm, all the guidelines that are around neoplasms, right? Primary, secondary, history of, things like that. Yes. That's
So
why
know
they're
your
designated.
guidelines.
Know your guidelines, right? Just constantly knowing your guidelines surrounding these diagnoses, and those are the main ones. The CDI, or documentation improvement, 12 questions. Now, one of the things about CDI is your ability to identify inconsistencies, and this is something you're called to do in risk adjustment. What's different about Another thing that's different about risk adjustment versus other credentials is that you're looking at a year's worth of documentation a lot of time for one patient, not just one encounter why that patient was seen that day. Uh, so if you're in there in the trenches coding regular, say pro fee, you're coding for 30 patients, all one encounter at a time.
Mm.
Whereas with risk adjustment, you're looking at a year's worth of documentation that could be everything from their primary visits to physical therapy to neurosurgery to ER visits. It's very expansive. Home health, because there's a lot of approved documentation that you can use to abstract these diagnoses. Well, with that, you have to be very keen in reading different EMRs, because you're not going to be looking at one EMR system. You're going to be looking at some from all over the nation. Uh, and they put things in different areas, and there are guidelines about what you can and cannot abstract from. So your ability to spot inconsistencies in the documentation is really key, and that there's always errors. And some clinicians are great at documentation, and others aren't so great. Communicate with the providers. Now, there are many types of risk adjustment roles. If you're in the trenches coding for an MA plan, then again, you're looking at 12 months at a time all over the United States. And but you you won't be talking to the providers. However, now so many of these entities, and especially teaching hospitals and large provider groups, they are aware how important and how much money comes in with these risk adjustment um, uh, MA plans, that they want to be ahead of the game. And so they'll have huge risk adjustment teams. So when I worked for Baylor, there was a bunch of us. I think they had like 30 coders, and then they had like 4 education people. And I was part of the education to the providers on risk adjustment and what needed to be documented. But those coders were looking at just the documentation for that entity for Baylor. So again, they would be talking and querying clinicians. So some jobs you will, some jobs you won't, but you still have to make sure you understand how to document or read documentation and looking for gaps. We move on to look at the pathology and medical terminology anatomy. You get 5 questions. And again, these should be gimmes. And this is a classic example. Know your key terms. Know, I would always ask people when they wanted to know if they needed to pick up another course in anatomy or pathophysiology. Uh, Say they took it in college a long time ago and they wanted to get into coding. And so I would ask them a question like, what's a cholecystectomy? Or what's cholecystitis? And if they said, well, I think it has something to do with colon. No. Then I knew, yeah, you need to take the course. If they said, oh, that's right, itis is an inflammation, right? Yes. Oh, isn't an ectomy a removal of something? Yes. So you're close. You're right there. But they didn't remember, because coli is CHOL, and it's the gallbladder. So that is a way to know where you are. And if you're in doubt whether you need assistance in this area, reach out to our team and we'll help you. We'll let you help you figure out whether you need more work. But these should be 5 points that you should just nail. You
Yep.
shouldn't have any trouble with them.
And one tip with medical terminology, sometimes you can use your index. And you might not know the word, but you'll find it in the index and it'll point you to that part. And you're like I think one time I took an exam with this obscure bone of the foot. And I was an occupational therapist. I taught medical terminology. I did not know this bone.
Right.
But I went to, I think at the time it was the CPT manual. And it directed me where to go. And I'm like, oh, that's the foot. And then I got the answer right because of that. So you can even figure it out if you don't know it.
That's right. Even if you, because medical terminology is often based in Latin, so the words don't necessarily jive with English, but a lot of it we still use is common knowledge because we've adapted it. However, your manual is brilliant to help you along the way and get you linked to the proper terms. But you don't want to be lackadaisical in that area because your knowledge there is going to help you in all those other categories of the exam. Uh, Understanding what the purpose and use of risk adjustment model, 10 questions. This is really important. So when we tell you that you're abstracting to be able to budget how sick a patient was last year to take care of the funds that are needed for the patient this year and in the future, how do we do that? We data mine. And what is data mining? Data mining is literally you abstracting the content from the patient's record and putting it in the system so that it can be tracked. And this has a lot of analytical work behind it. And then in addition, understanding the trumping process, we talk about this a lot in the course. And the better you know the disease process, the easier it is to understand this. So if you have a diagnosis, if it exacerbates, then of course that's going to be a higher or more complex, more severe. So it's kind of that thought process. So that's why understanding the disease process is important. Quality of care, you're only going to have 3 questions here, but what you need to be aware of is that there is oversight in risk adjustment. There's oversight in a lot of areas, but what we're looking at here is the effectiveness of the data that we're capturing. That all falls under HEDIS. The star rating, what's the patient's experience? Do they have access to care? Is their outcomes good? Are we maintaining or improving? We don't want to fall short. And then with risk adjustment, we take all of that information and we get a performance. If, again, maintaining the patient's health or seeing improvement. And so you'll learn more about those in the course. With the risk adjustment model, you'll have 15 questions. You're going to need to know the basics about the Affordable Care Act. And again, you may know some of this as common knowledge, but we go over in depth all of this information that you're seeing on this graphic. Excuse me, the Affordable Care Act, the Chronic Illness and Disability Payment System, as well as the HCCs, which stands for hierarchical condition categories. And what about private payer risk adjustment models? Because this has worked so well since it's been around since the 80s. It's worked so well that now it's into private payers. And we'll explain that in the course, but you will be tested on that. The 10 cases, don't freak out, but this is just your ability to be able to abstract, be able to read an encounter and pull out the content, what you can and cannot abstract and why. And then because it's multiple choice, it's relatively, it's pretty easy. And you can probably catch a lot of this in the multiple choice on your knowledge of the coding guidelines and the code set itself. So they'll be able, what they want you to be able to prove here is that you can read the documentation, that you can identify and abstract the diagnoses, and that you can get the diagnosis at the highest specificity, and then you can get it into the reporting standpoint so that that you can get the information out.
And it's
Oops,
multiple choice. It's not
multiple
fill in the
choice.
blank. So
Yeah.
it makes it a
Which,
little easier.
yeah. Common questions about the style. Well, it's scenario-based questions. So they just don't ask you, give you A, B, C, and expect you to say it's X, Y, Z. No, they're going to give you a scenario. A 50 or a 69-year-old male with diabetes and COPD has started having increased foot pain, and ultimately, after all the information, you find out they're diagnosed with neuropathy. Then you've got to be able to link the neuropathy to the diabetes, and so on and so forth. So your knowledge base of the guidelines, the definitions of those diagnoses, and any policies that are in play, that's multi-step coding questions. So you're going to have more than one diagnosis. So I can come up with 6 or 7. And think about diabetes. Well, you can have 3 diabetic codes with one patient. So there's 3 right there, and again, knowing that you don't code E1 1.9 with a patient that's an E1 1.22, little things like that. The tips that we give you. Read questions carefully and highlight key details. Now, you can do this somewhat with the online format, and they have made improvements since they've started allowing the online. I'm hearing the testing center is the way to go, but it you can still highlight those key words. Eliminate clearly wrong answers. That example I just said, if one of the scenario options, like A says, you see that E1 1.9 and E1 1.2 is on the same option, you can't code E1 1 and 9 and E1 1.22 together. And so that's out right there. And we relish in teaching you how to work multiple choice questions. We've been doing that for some time. And then, using those coding guidelines to confirm. And that's why we impress upon you how important they are. Strategies for time management. Again, you're going to give yourself about 2 minutes per question. If in fact you think a question you're not getting it, don't dwell on it. Just pass it. And you can do that in the electronic format. Track your time at the halfway point and make sure you're using your manual efficiently. So you can't have like Post-it note tabs, but your manual can be tabbed, and that's important. So know your manual inside and out, where everything is, so that you don't have to be filtering through that and wasting time doing pages. Understand where the divider, where your index is compared to your tabular, and so on.
And I was going to say, with they're kind of preventing you from using, in the old days, we used to have a printed exam. We could highlight, underline, scratch things out. Nowadays, it's not like that. If you do the exam site, and I think even if you do it from home now, they give you a virtual whiteboard. So it's on the screen. So you have to type. You're not going to be doing anything by hand. So what we recommend is when you do a timed practice exam, simulate those requirements from whoever you're taking the exam from. It's not always AAPC. It could be a HEMA. Figure out exactly how they do it. With AAPC, they have a little virtual whiteboard. So get used to typing, like maybe shorthand. So if you have certain codes, you can write it down, and either you're using a paper manual or you can rent a book from the AAPC. It won't have any markings in it, right? So keep that in mind. But when you have 4 possible answers, if any one of the codes, maybe there's 4 codes in each answer. If any one of the codes is wrong, the whole answer is wrong. So don't even bother looking the other stuff up. Just cross it off. So what I would do on my little whiteboard, I type in A, B, C, D. And next to A, if I, ruled it out, I just put an X. And I keep going, and I'm doing, C is wrong. So now I'm left with B and D. What's the difference between the two? Any codes that are exactly the same, don't bother with them. You're looking at the differences till you find one that's wrong. throw out that. Don't even bother looking up any that you didn't get to yet. You've eliminated 3 out of the 4. Move on. You got 2 minutes. That's, called the art, that's process of elimination. And then in our bonus area, when you take a course or blitz with us, you get access to the art of skipping, how to do POE, process of elimination, all these test taking kind of tips. So that was my little blip.
Yeah. So strategies for time management, we already went over that. And then moving on, the prioritizing study areas. Again, the HCPCS categories. Not HCPCS, the HCC categories. My brain just automatically said that. The HHS versus CMS, we'll talk more about that. One is Medicaid, one is Medicare. The guidelines, how many times we should have like had them do a little flag or a little burst of something every time I say coding guidelines. The documentation requirements, because again, just because something is stated doesn't mean it has meat, which we talk about in the course, and that you might not be able to capture it. You need to identify what your weak areas are. If it's terminology, then sit there and go through flashcards, start bringing your ability up, or take our ancillary course that brings your knowledge up in those. If it is the guidelines, then again, keep going over those guidelines. Use practice exams, but do it effectively. Now, we have practice exams both in ICD-10 and for risk adjustment, but know that say you're going to sit for the CRC and you've already taken the CPC, we still have CPC practice exams, and you could go through and take those, even though you're not going to be tested on the CPT, but there's going to be a wealth of ICD and guideline refreshers within that for ICD. So I'd encourage you to do that. Make sure you're timing yourself, simulate the real exam conditions, just like Laureen stated. Review every answer, correct or not, because in our practice exams, we give you rationales, and they are golden. They're in depth. Not only why you missed this one, but why these others were incorrect or correct. And then note patterns in your mistakes. Is it because you went too fast? Is it because you didn't look at the last couple characters that you struggled? Is it a lack of knowledge in, say, the regulations that you need to pick up more information
Not
on?
skipping hard ones.
Correct. That'll make you
miss
lose
30,
time very fast.
Skip. You can always come back. The ones that are taking you too long.
It's very common for you to look at something and then just freeze. And honestly, it could be you just need to pop a piece of chocolate in your mouth, but your brain is so intense, and we give you a lot of testing tips and stuff like that. But track your progress over time, see what you're improving in. And this is where our coaching in our courses really is beneficial, because we track you as well, and you can bounce ideas and questions off of us, especially if you think you're struggling in an area, or we look at it and say, no, see, the reason you missed this was here, not what you were thinking. Oh, and so having that second set of eyes to help you. Now, some resources that are going to be helpful. Again, we have the exam prep course with our CCO risk adjustment RAC course. And then we also have the CCO Risk Adjustment Coding Review Blitz. And a blitz is for somebody that's already taken the course and now they're ready to really practice for the test. Or it's somebody that is real knowledgeable and just wants to see, hey, I don't think I can pass the exam, but I'm close. Maybe you've taken a course with somebody else and you just want to see how good you are. You could take a practice exam and that would help you. We've got the CRC practice exam, but that blitz, you can talk with us and we'll help you decide whether you need to take a full course or if a blitz will be beneficial. But know that if you take the full course, the blitz comes with it. And then the AAPC has a how to take the certified risk adjustment coder test. And then the AAPC has practice exams as well. You want to take as many practice exams as you can. So we have our CRC practice exams. We have the ICD-10 practice exam. We also have the CPC practice exams, which would, again, be beneficial, in my opinion. And now we're ready for a commercial break.
Yeah, I was going to show real quick the different, when you go to cco.us, how you can look at those three products that Alicia mentioned, the full course, the review blitz, or what some people call a boot camp, and the practice exam. So, and I did put the links in the chat as well. But if you just go to cco.us, you'll see that we've got core courses, ancillary courses, the blitz reviews, and the practice exams. So it's pretty easy to navigate. So for core courses, we're going to go to the risk adjustment course, and we believe in very long sales pages. We let you know everything you could possibly want to know about the course, and you just keep scrolling and reading and seeing what's included, all the different features, and we won't, spend a whole lot of time going through it, but you keep going down and you keep going down, and then you get to the pricing. And we basically have either, we call it, do you want to rent the course or do you want to own the course? Okay. So if you want to own the course, lifetime access, it's $14.47. Those prices are going to be probably going up in January, so keep that in mind. You do get extras when you become a lifetime student. You get the phone support with the coaches. You get the review blitz is included. You get ICD-10 review blitz also included, and you get the mock practice exams. With the subscription model, it's basically pay $59 a month till you're done and then cancel. So if you can get through the whole course in 3 months, you didn't pay very much. But when that 3 months is done and you hit cancel, you get the rest of your time for that month, and then you're done. So if you want the course, you would subscribe to that. When you're done with the course, then you would either purchase the blitz or subscribe to it. So we're trying to do it so people can get in that maybe are on more of a budget, or the real reason we created it is we get so many people that find us after they've enrolled with someone else and they're unhappy. They're not getting the support they need. The lectures are boring, et cetera, et cetera. So I said, well, look, $59, try us to supplement what you've already paid for. If they use a different textbook, fine. You can listen to our lectures on the same topics and, combine it. And that is a really good way to take care of that problem. We wish you'd found us first, but we still want to help you and support you. So those are the two models for that. And then if I go back to the main menu, ancillary courses, Alicia talked about a medical terminology course, pathophysiology, pharmacology. Those are all really good courses that complement risk adjustment. So if you're interested in those courses, they're there for you as well. Here's the Blitz review for the risk adjustment. Again, long sales page, tells you everything that's included, all the topics, comments of people that have taken it, and the two pricing models, rent or own.
And Julie had asked, is the course 3 months, 6 months, or self-paced? It's self-paced, but if you want to know the average for budgeting your time, people, the risk adjustment course goes faster than studying for
one
the
manual.
exam. Yeah, because it's one manual. And so it is a little bit faster. Can you get through it in 3 months? Maybe. But I give myself 4 months, and it really depends how savvy you are on the background information, like the ICD guidelines and stuff. If you're coming in fresh and you've never done anything in the medical field, you better give yourself more time. However, if you've done other things in the medical field, it's going to go faster. And another question Wendy asked real quick. Wendy, we are actively working on the CDI course. Probably next month we'll be able to give you more insight about a timeline, by the end of this month, I would say, right?
Yeah, we're going to go over that right now. Let me switch over to, Where's that slide?
And Julie says, yeah, she's applying what she learned on the job. You're right. See, people who have had that exposure, you're going to go a lot faster.
Mm-hmm. Yep. So this is where we kind of just tell you a little bit about what's going on with CCO before we do our last topic. Again, we already answered this. Someone had asked about, will they get the handouts? If you're a club member, yes, you get all the goodies, all the handouts, the replay, access to me and Alicia afterwards, and CEUs, of course. So check that out, cco.us/club. We have 3 prices. We have a monthly amount, $24.99. We have a annual, $249. And with the annual, by the way, one of the benefits is if you've ever purchased any course or blitz with us and it's expired, if you become an annual club member, we will restore access for you to those courses. And as it gets updated, you get to see the updates. So that's a really good deal. And then the Club Plus, if you're one of those individuals that's like, I'd really like to do medical terminology and risk adjustment together, like do a little bit of each every week, then the Club Plus is for you. You get 2 courses and it's $329 to get in, and then it's $99 a month. You can cancel at any time. You can swap out courses. If you start with medical terminology and risk adjustment and you're like, you know what, I think I'd rather do the pharmacology because I'm starting to see how much understanding medication will help me in querying the physician, et cetera, et cetera. All you do, everyone who's a student with us gets a private support room. That's your go-to place for everything. Coaching stuff, help desk stuff, billing stuff, one stop. You just go in there and you tell, hey, can you swap my medical terminology for pharmacology? Sure. And we can do it like within hours. So it's not a big deal. The annual club membership, just so you know, is currently on sale. 20 days left to get it at $199 instead of $249. And what's nice about that is next year, when it comes due to renew, you'll be renewed at this price. You'll lock that price in. So as long as you stay a club member with us, that's less than $17 a month. So that's a really good deal for our club.
Yes, Elizabeth, we do have a billing course. Yep.
So yeah, go to that cco.us courses and you'll see the billing course there. Same pricing structure, rent or buy. And it also has a blitz and it also has practice exams. So this is about the CDI. We do have a priority list if you're interested in knowing, when it's going to be completely launched. However, we did start something last webinar. We are calling it a CDI Founding Student Promotion. It's going to be 50% off the regular price. The regular price is going to be $724 because it's an ancillary. It's half the, I'd say, length of a full like CPC course and CRC course. It's definitely an ancillary course because it can help with risk adjustment. It can help with lots of other courses or credentials. So,
and that being said, sorry to interrupt,
no.
It is really becoming more and more prevalent that what we do in coding is CDI affected. So your ability to be confident and be skilled in CDI is going to keep you right there at the top for jobs.
Yeah. So we will never offer it at 50% off if we have future sales. The most we ever do sales for anymore is like 25% off. So this is 50% off. This is to be a lifetime member. So even if you're not planning on taking it for a year, doesn't matter. You'll have access to it and you can take it and start it whenever you want. We're expecting the first module to be ready in about, I'd say, a month. Mm-hmm. So, we got the holidays going on. So probably, say February 1st is our target date. So you can go ahead and sign up now. And as soon as that first module is released, you'll be the first to have access to it. I had someone reach out to me today. They're like, I'm not going to be able to get paid till Tuesday. Can I be a founding member? I said, yeah, you'll be okay. We limited it to 50. So, you should be fine, but definitely take advantage of this new model that we're doing. We already talked about that. The YouTube channel. This is just where we let you know the different, we do every Thursday, pretty much we're doing something at CCO. Today is the second Thursday. So we're doing the community Q&A. Last week we did the podcast. Those are more lighter topics. And the third Thursday we do a Zoom call. Now that's just for students and club members, and it's done within our Academy app.
It's more low key and casual, and we laugh a lot. And
yeah, very intimate. Like you get me and Alicia's complete attention, and we normally only get like maybe 5 or less people, so they really get a lot of good time with us. And we don't have a topic prepared, but we always end up talking about really good meaty stuff. So and as a club member, those are recorded, so if you can't make the live, you can at least go poke your head in and see what we talked about and glean from it what you can.
Ophelia said she's already signed up for that, the previous. So, yoo-hoo, yeah.
For the CDI, good, smart girl.
Yeah.
And then the last Thursday is our club webinar. That's the one that is always got CEUs attached to it for our club members. But again, we broadcast this to everybody. Anyone can listen and learn from us for free. We've done that for many, many years, and it's our way of letting you see, our teaching style, the energy that we have, so hopefully that will convince you to give us a try. We do have an affiliate program. So if you are an influencer or, you have access to a large following that's in the medical billing and coding world, reach out to me. You can schedule a call with me, cco.us/Laureen-call, and we can chat about it. And our new platform, we love, check it out at cco.academy. It is free to join. We have a lot going on in the free areas. We have a discussion board. We have all these events listed there. Lots of people sharing and introducing themselves, and people supporting each other. And then it's the same area where you get access to all your courses, where you get access to the CCO club replays. So it's all under one umbrella. You get a private support room if you're a student. So Alicia and I go in and pop in there a couple times a day, and we get little dots, and we know exactly who to jump and answer. And it's kept us very, very efficient. So check it out. If you need a consultation from me, just pick pre-sales, pre-enrollment at cco.us/Laureen-call. I did put that in the chat as well. I tend to be available in the 4 p.m. plus evenings, and then Saturday mornings. So if none of those times are good for you, then just reach out to our help desk and, ask for some alternative times, and I'll see if I can accommodate you. And then topic requests, just if you go to cco.us topic-request, we have been getting a lot more coming in from that. It's keeping our interns busy. We have a whole process worked out where the topic comes in, we pre-vet it, we kind of come up with a little bit of a structure, the skeleton of a slide deck, we hand it off to the interns, they develop it more fully, and then subject matter experts come in and make sure everything's accurate, and we'll go back to the intern and say, you kind of take a look at this. We've been doing a lot with 2026 ICD updates. So there's a lot that you can learn. So, and I had someone today saying, how long does it take to get approved for an intern? So we're a little behind, but I'm committed to this Saturday to getting the 4 people that have applied onboarded. And you are given a little assessment, and it will test your ability to follow instructions, to work on a spreadsheet. So it has some coding questions. So it helps us vet people that maybe need to work on a few more things before they become an intern. So it's not a guarantee because we want to make sure it's not frustrating for you or for us. So that is a way that we've designed to help us help you.
And Felicia, this the CDI class is not a full course. It's an ancillary course. So I would say, you had asked if it would allow you to sit for an auditor's exam. It will benefit you in sitting for the auditor's exam, but the auditor exam covers other things very heavy in E&M and so on and so forth. But there is a CDI component to the auditor's exam, so it would be beneficial, but it's not a full course to help you set for that. And then Catalina wanted to know real quick, how did you enroll in the CDI course again? Can you just show her real quick?
Yeah. So if you go to
a couple slides.
This is the CCO Academy. So if you come in here and you go down, I don't know if she put it in here yet. Let me check. Oh, she did. Mary's wonderful. She's our project manager. So if you go to the Academy on the desktop version, your sidebar is where you get to all the different areas in the Academy. If you're on a tablet or a phone, you have to, up on the top, click on spaces. These are called spaces. Or, like Facebook calls them groups. This app called Circle calls them spaces. And so you'd go at the top, just to give you an understanding of the layout. You've got the events on top. You've got the help desk next. This is the community area. This is the free area. You do not have to pay for anything to come in here. This is our premium area. This is where we have the club replays and CEUs and discussion topics that we only do with the club members. The Bat Cave is where you get the annotated CPT and ICD-10 guidelines to add to your books to copy from. The mind maps and the pearls are very helpful for the risk adjustment. And they go into a lot of those top diagnosis codes. And the mind maps go a lot into the ICD-10 guidelines. You can really kind of memorize it, helps you sound down that information. This is where we talk with our interns. And this is the list of ancillary courses. So now I'm going to jump into the CDI. And, oh, that's not going to work. I got to log out.
While you're doing that, Wendy had said, I already have the CPMA credential and want to also obtain the CDI, thinking it will help my career. I agree 100%, Wendy. It is really, really important. I see your ability to do CDI as a major role in a coder and future career options.
So with this community, if you see a padlock, it means it's a paid area. So if you go down to CDI and you click on, go down to ancillary courses and click on CDI, it will not do what I thought it would. Sorry. Let me find the other, where did she put it? I know it's in here somewhere.
While she's doing that, Felicia asked if there was an exam for becoming CDI, and yes, there is. You can go through ACTIS, you can go through the AAPC, and you can go through AHEMA. There are several that you can go through, so we can help you follow through when you get ready to test.
Here it is. Let me put this in the chat.
That's the big announcement, yeah.
Yeah. And then I'll, since this is in the public area, I'll put the link. All right. So let's do our last topic. And we can stay on at the end if you have more questions, but we did want to cover our second one. It's not a super long one, so we should be fine. This question actually came in quite a while ago. On one of the students had asked this question. I think they got all done and they're like, this just really isn't for me. What can I do with all this coding that I learned? So that's where this came from. And I called it pivoting from coding, where you had a certain direction and now you want to pivot. So earning your CPC or a like credential is a huge accomplishment. But if you realize that traditional kind of heads down stack coding really isn't right for you, then you can take that knowledge that you learned about ICD, CPT, HCPCS, and maybe put it into other healthcare roles that maybe you didn't even know existed. So this little presentation is going to go into that. One of the things you could consider, it's kind of what happened to me. It seems a little backwards that you think you would really need to do a lot of heads down coding to become an auditor, but you could actually go right to auditing. It depends on your personality, how you can present yourself to get potential clients or work for an auditing firm. But that's something you could look into because auditing is a little different in that if you're being paid per chart to do an audit, you can take as long as you want. No one has to know. You're going to normally charge piecemeal. So if you're slower initially, but you do a really good job, then over time you'll get faster and faster. And auditing is, you can do some research, look some things up, you create like a report, you do provider education, all, tied with it. That's what CCO has, an auditing service. It's called Coding and Compliance Optimizers. So if you work for a facility that needs some third-party independent auditing, give us a call. We will help you with that. So you review coded records for accuracy and compliance. You can do it for hospitals. You can do it for insurers, government agencies, physician offices, billing companies. And it's better than heads down coding for some because it's less repetitive, and you can make more money with it, and you get more interaction with teams because you're trying to educate the different, you might be educating the coding staff, you might be educating the billing staff, educating the providers. So if you like to present, then this might be a choice for you. Any thoughts on auditing, Alicia?
No, I just, one of the nice thing about auditing is that in the past, they wanted you to, have lots and lots of experience before you become an auditor. But times have changed in that a lot of times they need a second set of eyes to look through things. And the great thing about auditing is the answers are already there. So you're looking for gaps and mistakes and trends. And again, that's where the CDI aspect comes in very heavily. But yeah, auditor is not like it was in the past.
Yep. You want to talk about this slide about compliance officer?
Compliance officer is pretty exciting. It's something that I always wanted to get into. However, I didn't. It falls a lot in with CDI, but to be able to be a good compliance officer, you have to remember that you need to be able to uh, work from the legal standpoint, right? You are often used as a tiebreaker in decisions. You're making sure that your compliance notebook is up to date if you've decided to code in a certain way. So ultimately, with the CHC, you ensure your organization is following the regulations, and regulations are constantly changing. Just look what's happened with telehealth, where one time you can, and then you can't, and you can't, and right now we're back up to January 30th, that things are allowed. So you have to be on top of that, and then you have to be able to articulate that to all the people in the team, not just the clinicians, the providers, but the coders, the analysts, and such. um, uh, Develop compliance programs. I would say that if you're with all coding areas, you want to be real savvy with Excel, but with compliance, I would say that's where you really have to be good at note taking and bringing in information that can be reams of papers long and concise, making it concise so that it can be articulated to a large group of different people. You have to do a lot of training. It's a lot of face-to-face work. You have to be good with correspondence. But why it's such an awesome job is that it's a lot of problem solving. So if you like puzzles, if you like being able to solve what's happening and come up with maybe more than one work plan so that others can decide which way they want to go, that this is right there for you. There is a huge demand for this in hospitals, because the office, if you're in a private practice or even a large, or maybe an ACO, they'll have a compliance officer, but hospitals have to have multiple compliance people because it's such a large entity. But don't forget things like consulting firms that
Mhm.
need somebody that has that compliance background. We get questions a lot about, are we going to get audited? Well, let's look at what you're doing do the audit, then let's look at your education, bringing everybody up to par. But then let's put together your compliance platform so that when you do get audited, because you will, that you know that they can see that you're proactive. So again, it's a great area to be in.
Yep. You could become a coding instructor like Alicia and I.
Mm-hmm.
You don't have to be certified as an instructor, although the AAPC does have a program. I was in the very, very first class that they had when they did it many years ago. And they do give you a certification exam. It's basically a mini CPC exam.
Yeah.
And, but coding is fun. It's different. You prepare lessons. Like we are having a blast getting the CDI course ready. I mean, we have a team that's helping us do it, but we're making it so that we have a textbook. We're actually creating the textbook. It's our first time doing, well, actually our second time.
Second time.
But the first time we're actually going to make it a part of the course. You won't even have to buy a book unless you want like a reference book. But as far as the instructional part and how to do it, we're providing that as part of the course. And then we decided for the first time, instead of having like a traditional 90-minute lecture or 2 hours, we're going to chunk it up and do it in sections so you can consume it easier. So if chapter 1 is 3 sections, maybe Monday you do section 1, Tuesday you do section 2, instead of feeling like, oh, okay, I got to stop the video at this point. And so we're going to be doing that. And then each of our chapters is going to have a testing module so you can test your knowledge. And one thing I didn't mention about the Academy, we also have an AI that's trained on all of the content in the Academy. So you can go, it's called Cody. And you can ask Cody, say, hey, I just finished chapter 1 of the CDI course. Could you ask me some review questions before I take my end of chapter exam or my module exam? And you can go back and forth and you can say, I don't understand that. Could you clarify that? Could you, and what it's doing is it's reading the transcript from the lectures and the materials that we're putting into the course and synthesizing it and giving you an answer. So that's pretty cool. So that's about being an instructor or a trainer. You can be a trainer like at a hospital of physicians. A lot of times I had a good friend in Pittsburgh and she taught the physicians about E&M and really helped them to improve their documentation. Alicia and I are going to be meeting with the physician practice tomorrow evening and helping them how to do, their practice and, what are typical things that in their specialty is left on the table that they're actually doing with the patient, but they're not documenting and therefore they can't bill it. So you can do that kind of education. So,
and NAMUS, they have a brand new physician education boot camp. So if it is something that you're interested in, that's another excellent organization to be involved with. That can help you right up that alley.
You want to do denial management?
Yes. Now I work with a lot of people that do both of these, denial management specialist and revenue cycle analyst. If you like working with numbers and grids and all that other stuff, these analysts, man, they love what they do, but a lot of spreadsheets, and I never thought that I would enjoy that, but working with them, I've learned so much, and I know that I can do it now. But and then when you go into denial management, and not only denial management, I throw in here also pre-authorization. That is huge. And it is each one of these positions, denial management, revenue cycle analyst, as well as the other one I just mentioned, they are full-time jobs in hospitals, each individual one, and they can be part of a big team, but that's what they do all day and they love it.
And you become familiar with the appeal process, how to write, appeal letters and things like that. So it's just another angle, but the core is under the codes are driving the reimbursement and all of these things. And that's why having, you can pivot easily. You can get CPC thinking you're going to be a heads down coder and pivot to something like this. And this isn't just for people that don't want to do heads down coding. They might want to expose themselves to other areas. It's like being a nurse and you're an ER nurse, but you want to get into cardiology. And so you
Mhm.
might take some courses to get up to speed on all the unique differences of being a nurse in that specialty. It's the same with coding.
The people that excel at these arenas are people that have coding backgrounds,
Yeah.
meaning they've taken a course and they understand the code set, even if they didn't pass the CPCT or CPC, but they are very knowledgeable with the code sets. Those people excel.
And we've been talking about this a lot tonight, the healthcare documentation specialist. CDI is clinical documentation integrity. An older name was clinical documentation improvement, kind of the same thing. There's lots of credentialing bodies out there.
Mhm.
AAPC has one, but that's for outpatients. That's the CDEO. There's inpatient ones that AHIMA has, and ACDIS, ACDIS. What's
And
really great about the course we're creating is we're doing both sides,
yeah,
inpatient and outpatient.
and
And we have looked at all the domains for all of the credentialing bodies, and we're
mhm.
making sure all of that is in the course. Sorry, Alicia,
Right.
go ahead.
No, I was just going to say, ACDIS has the CCDS for
Mhm.
inpatient and then the CCDSO for outpatient. And that outpatient has only been around for about 5 years. So it's
Yeah.
relatively new for them.
And it's again, this is a little more physician facing. So you want to make sure if you're shy or you don't want to do that kind of role, then this might not be for you. But sometimes it's, querying the physician. Like, what I remember when I was learning, you can't give them kind of leading questions like, hey, you gave them Lanisopril, which is for high blood pressure. I don't see a, whatever diagnosis. It's
Hmm.
more, there's an art to how you query the physician to be in compliance.
Yeah.
So
And it could be something as simple as, is this is this antibiotic, is this medication a high risk medication? Why in?
yes or no,
Uh,
yeah.
yeah.
Yeah. And here's a beautiful graphic that Kristen developed for us. I was telling Alicia, I said, this just makes me salivate.
Yeah. The great
But it's
graphic.
just a comparison chart of what we talked about being an auditor. Now, a lot of these credentials, there's more. It's just,
Yes.
for space reasons. And, AAPC isn't the only organization out there, guys. Look, do a Google search, ask your AI, what certifications are there for XYZ? And,
Mhm.
shop around, look at them.
Mhm.
You'll find that if you're more on the facility inpatient side, AHIMA is a little more respected for that. Doesn't
Mhm.
mean your AAPC credentials won't work. It's just, that's what they tend to like.
And
Go ahead.
billing, AMBA, very, very
Mhm.
good.
Yep.
With Actis is one of the leaders in CDI. However, they have a huge uh, prerequisite. You have to have
Mm.
documented 5 years experience in CDI.
Yeah.
So it may not be an entry level like the AAPC, but there's so many out there that are
Yeah.
quality
I mean, you could have been a heads
organizations.
down coder for 5 years and be like, yeah, I want to pivot. So you've got the 5 years, but now you can, do different
Mhm.
things with it. So these are all things we talked about. This slide will be in the slide deck and available in the club very soon. So our final thoughts, your coding certification, not just CPC, any coding certification opens doors beyond
Mhm.
traditional coding. So if you're feeling burnt out on what you're currently doing, consider transitioning into one of the fields that we just talked about,
Mhm.
and coding will be a foundation of all of these.
Right.
So, and research your certifications. Don't just get married to one organization. Shop around. When I was first doing this, I was in AAPC and AHIMA, and then AMBA for the billing.
Yeah.
AMBA was really fun, super focused. If you're into billing, and a lot of billing company owners with that.
Right.
So we still highly
And
recommend
they
that.
have a coding credential now, and they've expanded and grown. They're very well recognized.
Yeah.
Uh, so yeah, there's just so many great organizations to be involved in now.
Yeah. Well, thanks everyone. That was a fun one
Um,
tonight.
and
Let's
so
see.
one more
Mhm.
question. Do you have a, let's see. Uh, Margaret, real quick. Can you review the cost of membership again and where to sign up?
Sure.
for the $199 still active. And let's see, while she's pulling that up, Gina said, do you have a course prep for the CRCR? I'm not sure what the CRCR is, Gina. Give me a heads up, or I'll have to check it. That one's not ringing a bell for me.
And we have the CRC.
CRC, but not the CRCR.
Yeah.
And then lots of kudos coming in. Thank you, guys.
So for the club, actually, let me just take you to the website. It's probably easier.
Yep.
So if you go to the website and you click on Hot, I think you'll see CCO Club. And it's basically just cco.us/club. And you can read all about what's included. We already talked about it tonight. And you just scroll down to the pricing table. And right now you'll see it's in there for $199. After January, or on January 1st, it's going back to its $249 price. We lowered it to $199 in honor of launching our new Academy website that we worked all summer on to get it ready. And we launched that in July 4th. And yeah, so we've kept it on sale for quite a while. So it's time to put it back to where it was in January. So lock in that price. And, you know, as long as you don't let it lapse next year and you don't cancel it, you will get that price, you know, indefinitely.
So Gina said that was denial management, revenue cycle management. No, we don't have anything on that now, but we do have a billing course. And if that is something that you would like to see us develop, then absolutely we can think about, you know, working on that after the CDI is launched. And Letitia said that she was having trouble signing into the CCO community. Whenever that happens, if you have any trouble, you know you can send a note into helpdesk@cco.us and we'll be right on it.
And I'll be honest, you will probably get a less friction. You know, sometimes it's a pain to fill out that help desk form. If you go to the community or the Academy, cco.academy, automatically when you join, you get connected with the help desk account. And you can just type a quick message, like a text message, and let them know, and they can jump right in. And right from the Academy, we have a link that takes us to our back office where we, you know, everyone that interacts with us, we have the whole history, and they can research your account and see what's wrong. You know, it could just be a password issue. It is the community website, which is where you take your exams, is a separate login. Some people don't. They miss that in the welcome email. The Academy is one login, and the community where the exams are is a different login. It's our legacy system. So
yeah, and Elizabeth had said that she didn't do well on the CPB, but she wants to study again. We're right there for you. We've got great practice exams and stuff to help you, Elizabeth. So check in with us on that.
Yeah, and at the CCO website, if you go to where that menu that said hot, that's our proven process. If you click on the proven process, it tells you the steps to be successful to pass. And since 1999, I've done many exam retake calls, and we go through the proven process, and they're like, well, yeah, I did the course. I said, okay, did you do the review blitz? Yeah, but I didn't get through all of it. I said, okay, did you bubble and highlight your CPT manual? Well, some of it. I said, you know, so you can start to see where, and did you do practice exams? No, I ran out of time.
That's where the gap was.
then I said, then what you did in essence is you made your real exam a practice exam, because now you have to retake it, which is okay. But now you know what you got to do. So the proven process works. That's why we call it a proven process. If everyone does all those steps, then I don't think I've ever talked to anyone who did not pass when they did all the steps.
Right.
And the timed practice exams, because a lot of people go, well, I'm not done studying. I need to study. No, you don't. Do the timed practice exams, because what you get wrong and you look at the rationales will teach you what gaps in your knowledge you have.
That's right. That's the study.
That's your last minute studying, is doing the timed practice exams. Do not skimp on timed practice exams. They're not expensive. They're like $35, $39. You know, we have a ton. AAPC has them. There's, you know, I can't speak for other organizations, but I know ours, we're told are harder than the real exam. And they're very thorough with the rationale. So any other questions?
No, I think that's caught us up. You guys, thanks for sticking with us. And don't forget to tell your friends and your peers and people who are thinking about getting into the industry that we're here. You are our best advertisement. We really appreciate you. So get out there and do that social media for us, that buzz. That's very, very helpful.
Congratulations, Felicia. She sat for CRC.
Ah, great. Oh, that's great, Felicia.
Well, thank you, everyone. So next Thursday, do we have a webinar? Oh, that's our Zoom call for our students and our club members. So yeah, go to the Academy, cco.academy. That's where Alicia and I are hanging out, and the help desk is hanging out. We're really trying to move everything over there where all the action happens. So, and you'll get little pop-ups, and you can download the mobile app, and it's really cool and makes it very fun. It's easy, very user-friendly.
So thanks, Joyce. She's been with us for 5 years.
Wow.
Great. And now she's got the CPC and the CRC, and we helped her understand the E&M. Thank you, guys.
Yep. And yes, happy holidays, everyone. And we'll see you soon. Yeah, we will not have a webinar, obviously, on Christmas or on New Year's. So we're going to get a little Thursday break for those 2 weeks. But next week we have the Zoom, and then we'll be back on our every Thursday schedule again. And all of the events are in the Academy. You just log in. It's right at the top, events. And you can see it right in the calendar. You click on the link and you register, and you get all the fun reminders. So
appreciate you guys.
Yep. Thanks, everyone. Thanks, Alicia.
Bye-bye.
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.